Hi, Dr. Brad Harmon with Harmon Dental Center, Louisville, Kentucky. So I went to school at Ohio State College of Dentistry, graduated in 2005, had a lot of surgery background at that school, and then I went into the Army and I had a lot of additional surgical training there. I started placing implants really shortly after dental school in 2006, and I've been placing them since. We're all come out with a base level of understanding and training through dental school, but then it's upon us to then advance that training throughout the rest of our careers. We become lifelong learners. So I think what sets the difference between a qualified dentist and one that's not qualified to place implants is training. And so someone who has chosen to become an expert in implants requires a lot of training, a lot of additional continuing education and pouring into perfecting your ability to place implants successfully. So continuing education is important because it's our training, it's our knowledge, it's what we bring into the surgery to make sure that we're keeping patients safe and having excellent outcomes. Your surgical abilities start to progress and advance, and then you start doing arches, and you can really help people when you start doing full arch implant dentistry. To do it at a very high level in complex or compromised situations requires additional training that not everyone has. And so I think where dentists get themselves in trouble is they think that every bone can receive the implant just as it is. And so they're not really ready to handle the complications. Anyone could put an implant in a bone. Not every dentist can handle the complications that might arise from that. So, failure complications, infection complications, when these fail, they can be catastrophic to the bone. So as much as an implant will hold bone in place, when it's done poorly, it will deteriorate the bone. And so unless you're really able to handle those complications where you can regraft, you'll be able to remove the implant, know when to remove it, know when to repair it, those kinds of things, that all goes into training. So as a member of the American Academy of Implant Dentistry, the reason that's important is that you start tying yourself to be affiliated with like-minded professionals, people who do this at a very, very high level in the field. And so when you align yourself with people like that, you're learning from the best. I mean, it's important to stay up to date because science is science and it's always evolving, it's always advancing. And so unless you are staying on the cutting edge of what that technology is, then we run the risk of falling behind. And so even if you got your training 5 years ago and you're not staying abreast of current technology, you're going to be behind. So call our office today for a free consultation to see how our experience and our love of dentistry to give you the best results possible.